meaning that it can also cause illness in humans. Also of note, the lepto portion of the combination vaccine has been linked to vaccine reactions ranging from facial swelling and hives to acute anaphylaxis. Additionally, the vaccine is believed to offer protection against only a few of the more than 100 species of leptospirosis strains found in the environment. For this reason, AHA has classified this vaccine as non-core, except in those endemic areas for lepto. One of the P's in the combination vaccine represents the virus that causes parainfluenza. The virus primarily affects the respiratory system and is highly contagious in congested areas with poor air circulation such as pet stores and shelters. Transmission is via the oral nasal route, and the main clinical sign in an infected dog is a harsh persistent cough, sometimes referred to as kennel cough. Infection with the parainfluenza virus often leaves the door open for secondary bacterial infections to occur. AHA classifies this vaccine as non-core. Keep in mind that non-core means optional and depends on geographic and lifestyle exposure, thus leaving the decision to vaccinate up to the veterinarian. Parvovirus, the other P in the vaccine, is probably the most commonly seen disease we are discussing in this section. Disease transmission occurs when puppies or immune-compromised dogs ingest infected feces. The parvovirus primarily attacks rapidly dividing cells. Because the cells that line the GI tract are constantly multiplying, the virus targets that lining and literally causes it to slough off. As a result, the intestines are left without their protective internal mucosal lining. Commonly seen signs of disease are vomiting, followed by profuse bloody diarrhea. Because of resultant poor absorption and loss of body fluids, dehydration is a serious concern. If left untreated, the virus has a very high mortality rate. AHA classifies this vaccine as core. AC or CV may or may not be included in the combination vaccine representing the coronavirus. To simplify our explanation of the coronavirus and its corresponding disease, it often presents a mild version of parvo. Like parvo, it is a disease of puppies or unvaccinated adult dogs. Unlike parvo, it does not typically cause vomiting or bloody diarrhea. The diarrhea is caused by malabsorption rather than a sloughing of the intestinal tract. Coronavirus fortunately has a much lower mortality rate and often goes unnoticed in healthy dogs. AHA classifies this vaccine as not recommended. The report states that prevalence of clinical cases of confirmed CCV disease does not justify vaccination and that clinical disease rarely occurs. When it is seen, it is typically mild and self-limiting. The rabies vaccine is the other major dog booster given. It is commonly abbreviated R or RV for simplicity and consistency. Fortunately, because of the widespread use of the rabies vaccine, the occurrence of rabies has dropped substantially. The virus concentrates in the saliva of an infected animal and thus spreads primarily from a bite wound that breaks the skin. Once the virus has entry into its new host, it migrates up nerves into the spinal cord and eventually ends up in the brain. Once the virus has made its way to the brain, the disease becomes transmissible and signs present. The first stage, the prodromal stage, has been reached when the animal's larynx begins to spasm and a personality change occurs. The excitative stage soon follows, and it typically presents as paralysis of the throat area, causing the inability to swallow. This paralysis tends to be mistaken for a dog that is scared of water or is mad, as evidenced by the foaming at the mouth. The last stage is termed the paralytic or dumb stage. At this point, the affected animal will suffer from general paralysis that leads to death. Specifically, the animal is unable to breathe due to paralysis of the muscles which control breathing. Because of its zoonotic nature, rabies is one of the only vaccines required by law for dogs in most states. Each state or municipality has laws specifying the age at which a puppy must receive its first rabies vaccine and the subsequent boosters. AHA classifies this vaccine as core. The last disease we will discuss that is commonly vaccinated against is infectious tracheobronchitis, or more commonly known as kennel cough. As we previously discussed, The viruses that cause adenovirus 2 and parainfluenza may lead to tracheobronchitis. The most common cause is a bacterium called Bordetella bronchoseptica. Typically, dogs are infected when they are housed in highly populated and often poorly ventilated areas, such as boarding kennels, grooming parlors, and shelters. The resulting cough sounds much worse than it is.